Hello, my name is Sohaila Bahir. I'm a fourth year optometry student at Marshall B. Ketchum University in Fullerton, California. Today I will be talking about one of the most foundational skills in optometry, effective patient communication. As clinicians, our communication shapes how patients understand their vision, how they follow treatment, and how confident they feel placing their eye health in our hands. Strong communication isn't just a soft skill, it's a clinical tool. Why communication matters? Communication impacts every stage of eye care. For example, think of a patient who says, I can't see well. Without effective communication, this statement is vague. But when we ask thoughtful questions, such as, is the blur up close or far away? Is it sudden or gradual? Does it change throughout the day? We turn a vague complaint into usable clinical data. Patients are more likely to share honest concerns when they feel heard, and that trust helps us make more accurate diagnoses. For example, a patient embarrassed to admit they sleep in their contacts may finally disclose it when we create a safe, non-judgmental space. That one of that one moment of communication changes the entire exam direction. Key elements of effective communication. There are three major pillars: active listening, clear explanations, empathy, and cultural sensitivity. When these three come together, patients not only understand their condition, they understand that we understand them. That connection is what makes communication meaningful and effective. Active listening and practice. Active listening is more than just hearing. It's demonstrating that we value what the patient is telling us. For example, if a patient says, my vision gets weird at night, instead of jumping to conclusions, we might ask, can you describe what weird looks like? Is it glare, halos, or double vision? Small behaviors, eye contact, nodding, and clarifying questions encourage the patient to open up. One of the most powerful techniques is reflecting back their words. So what I'm hearing is that your eyes feel strained after long screen time. Is that right? This not only confirms understanding, but shows the patient they are being taken seriously. Clear explanations. Once we understand the problem, we need to explain it in a way the patient can actually use. Eye care terminology can be intimidating. For example, instead of saying your cornea has reduced tear breakup time, we can say your tears evaporate a little quicker than normal, which can cause dryness and blur. Patients appreciate when we break things down clearly. A helpful trick is the teach back method, where we ask the patient to repeat the plan in their own words. Something like, just to make sure I explained that well, how will you use the drops at home? This simple step drastically increases treatment success. Empathy and professionalism. Empathy turns a routine exam into a positive experience. For example, consider a patient who comes in worried about flashes of light. Before diving into questions, acknowledging the emotion that can definitely be concerning, you did the right thing by coming in, helps calm anxiety and builds trust. Professionalism also means recognizing cultural, language, and generational differences. Some patients want detailed explanations, others prefer short summaries. Some cultures avoid direct eye contact, others expect it. By adjusting our approach, we communicate respect and make care more accessible. Practical real world examples. Imagine a patient with new diabetic retinopathy. This is not only a medical diagnosis, it can be frightening. Effective communication might sound like, I know this may feel overwhelming. The good news is that we caught it early and there are treatments and lifestyle changes that can protect your vision. Let's walk through this together. Here we combine education, empathy, clarity, and partnership, key components of strong communication. Finally, in closing, communication is much more than explaining results. It is a clinical skill that improves diagnosis, treatment adherence, and overall patient experience. When we listen actively, speak clearly, and respond with empathy, we create a space where patients feel respected, understood, and supported. As future optometrists, strengthening our communication skills will make us better clinicians and better patient advocates. Thank you for listening.